This is Emergency Strategies and Advancements in Pediatric Mental Health Care, a comprehensive review of emergency department practices and trends by me, Jonathan Dyson. For my project, I chose to do a literature review focused on the needs of pediatric mental health patients, specifically those that experience crisis. I noticed the need for improved care for these patients and a slow response to deliver that care. My ultimate career goal is to be a psychiatric nurse practitioner for pediatric patients, so I felt that this literature review and this particular project fit my career needs. And I hope to one day open up a clinic that specifically addresses the needs of kids who are in crisis but waiting for services. I believe there are multiple ways to solve problems, which do include legislation, but also include finding holes in the market and creating marketable solutions to help these people. Generally, these kids go to the ED, which is not an ideal place to receive mental health care. The aim of the research project was to identify current challenges, strategies of care, and emerging solutions. I chose Stephen Dyson as my preceptor. He is an APRN who works at Primary Children's Hospital in a short-term behavioral health facility in Riverton, Utah. He directly works with youth experiencing mental health crisis. He has many years of experience and a professional understanding of the problems the system faces. He also has high expectations for this project, and I knew he would push me to work hard to develop a polished product. The project itself, the literature review, consisted of writing a 20-page paper that addressed the problems associated with pediatric mental health and identify solutions to those problems. The idea was to complete the research in the month of June and write the paper throughout July. 30 studies were reviewed, about 17 were ultimately included, and the paper was completed in July. My mentor constantly reviewed the paper and offered suggestions to make it more readable, as well as provided insight into topics that needed clarification. The timeline worked out well for my project. There was no need to adjust the schedule of writing about 10 pages per week. The main difficulty I encountered was keeping the paper focused on a central topic over 20 pages. I had to rewrite sections to make them more focused on the topic. I also had to rewrite sections to increase readability for a more general audience. My mentor suggested that I appeal to a general audience rather than just a professional or academic audience. So I had to go through my paper and simplify some of the language within the paper. The goal of this project was to write a comprehensive literature review that identified issues in pediatric mental health care. Another goal of the project is intended to inform a general audience about this particular topic. The goal was achieved through the paper that was written and through the individuals that did read my paper, aside from my mentor. I have learned more about healthcare research, how studies are done, and how to search for information about a given topic. My end career goal is to open a clinic that addresses the issues that I have identified. With time, education, and further research, I will learn how to better address the issues at hand. I also intend to post this paper on my Facebook page to just show people what I've done, and hopefully they'll read it and gain some more insight. I thought about publishing, but I don't particularly like the idea of going through the process of publishing at this time. Perhaps in the future I'll refine it to a point where it can be published. Through this project, I have gained a better understanding of working with other professionals to meet a common goal. I have also gained better understanding of how to research a topic and present an unbiased and factual discussion. The knowledge that I have gained will help me in further academic pursuits. I will be seeking a master's or even maybe a doctorate degree here in the future. The knowledge that I will also use this knowledge to build a business that fills the holes that exist in the market. So as an overview of the paper, since I'm not going to directly read the paper here, the United States faces a shortage of pediatric emergency department beds due to staffing, financial constraints, and many other issues. COVID-19 really exposed an already overburdened healthcare system, and efforts to reduce pediatric ED overuse and low acuity visits have had limited success, hindered by many different barriers. Pediatric mental health patients are disproportionately affected by the stressed emergency healthcare system. They're frequently boarded. They sit on a one-to-one. They see a CNA or a tech rather than a nurse or a therapist or a doctor because they're busy doing things like treating heart attacks and other issues. Challenges include delayed and inadequate care, severe lack of follow-up from ED visits, and limited long-term therapeutic relationships with primary care providers. Emergency department doctors are not meant to be long-term care providers. They're meant to stabilize you and get you out, and stabilize the next person and get them to another floor. They are not meant to create long-term therapeutic relationships. The ED is open 24/7, is perceived as a safe and rapid option for mental health care crisis, but it may not provide timely and effective solutions. Addressing mental health issues is equally vital as physical health. This necessitates comprehensive solutions to alleviate these issues in the pediatric population. The emergency department serves as a front line for pediatric mental health. It's available 24/7, it's easy to get to, and TALA, for example, mandates that Medicaid participating hospitals provide triage and treatment to all, regardless of acuity or ability to pay. So if you come in seeking in crisis, in a mental health crisis, they will take you in. Outpatient mental health fields face resource shortages, long wait lists, and staffing shortages. Growing mental health awareness and increased risk factors necessitates effective solutions for children and adolescents in crisis. The paper focuses on 3 themes: the current challenges and considerations, current best practices, and emerging research. Through a literature review, the paper aims to identify barriers and effective strategies for pediatric mental health patients. And the analysis explores various research to determine what works, what isn't working, to find solutions that address these challenges more effectively. Pediatric mental health care is evolving with a focus on evidence-based practices to ensure quality care for pediatric mental health patients. However, there have been many barriers impacting the effectiveness of some strategies. Community outreach, school-based mental health care, and primary care programs for youth require further research to assess their potential in reducing ED costs for mental health care. A few of the strategies found in my research shows that telehealth could be a very promising way to expand access to mental health professionals for underserved populations. However, some of the medical and legal challenges need to be addressed, and evidence-based standards need to be created so that telehealth can be more viable. Mobile crisis response teams have demonstrated great effectiveness, but face barriers such as staffing shortages, finances, and community education. So collaboration and education are a few things that can enhance their effectiveness. Although there are some difficulties that persist in the current system, emerging strategies of care have shown some success or even great success. The CATS model, or Crisis and Transition Services model, offers potential in diverting youth from the ED and providing continued care during outpatient service waiting periods. The CATS model works in a way that allows children who get discharged from the emergency department to receive help quickly and effectively for a short period of time. So this model helps children. This model can be delivered either via a professional or by oneself through the computer or a packet. Single session interventions empower youth to address mental health challenges and offer training for caregivers in supporting pediatric mental health patients. The single session intervention is essentially saying that once the child is discharged from the emergency department or prior to going to the ED, the child is given a single intense session that lasts for a period of hours, or a few sessions throughout multiple days, one after another, that are very intense, to empower the youth to address their challenges and offer more training for their caregivers. This can divert youth from the ED as well. Lack of standardized protocols has been a major challenge. So implementing evidence-based protocols for reporting can aid in continuity of care and provide a clearer picture of the child's needs and challenges, especially when a child jumps from provider to provider to provider, or therapist to therapist to therapist. The child can have a very clear and easy to understand record that can go with them. To conclude, Collaboration between researchers, providers, and policymakers is vital in developing evidence-based strategies for youth with mental health challenges. It's going to take a village. It's not an easy problem to fix. There is not one issue or one reason for this problem. There are many reasons, and these reasons all need to be addressed in different ways. Continued research and evaluation are essential to improve care and outcomes for pediatric mental health patients. Combining evidence-based practices with innovative solutions can reduce the burden on EDs and enhance the overall well-being of pediatric mental health patients.